Hey YouTube world, it's Eric coming back at you with yet another update on my normal computer this time, so the quality should be much better. I don't know about the content. um, so basically this video, a lot of people will probably just skim over, especially the post-oppers, but I figured it might be of some use to somebody somewhere who's just starting their journey, um, who, you know, might want to find out more about what to expect, what questions might be asked of the doctors and stuff for the consultation. So the place I'm going to Bryn Mawr Hospital, which is the mainline health system in Pennsylvania, and they give you this entire packet to fill out before your consultation. Sorry, I have my lime water, and getting the hiccups. So anyway, I wanted to go over the packet, kind of go over the questions that you can expect to have to think about, and questions that you're going to be prompted to answer for your consultation. But first things first, one of the things that I didn't even know about going into this, and I'm not sure, I didn't really do any research on it, is the accreditation of MBSAQUIP. Is a really long acronym. Apparently it's a brand new acronym for something prior, but it stands for Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program Accredited Center. Apparently that's a good thing. The symbol kind of looks like that. So if you can find a center that is accredited through that, I hear it's a good thing. This center that I'm going to, the hospital and the program, is accredited. So that's that. I highly recommend going to a seminar if your program does offer it. It is very informational. I found myself saying, oh yeah, I heard a lot about that through the YouTube videos during the entire seminar. So, but there were things in there that I had no clue about. So, without any further ado, it is getting 3 minutes already. I'm going to get into what you can expect for the packet. So, first things first, you want to know all your pertinent information, name, address, phone number. They're going to ask you for who you work for. At least my place does. They're going to ask pharmacy information, referring provider, your emergency contact, and your insurance information. Seems like common sense, but you never know. Some people might not have this information. So, stuff that you want to have all together. They're going to want to know, like I said, your physician information. So if you have a PCP, which I don't, I'm not sure how that's going to play into this, but you're going to want to put all that information, get it together so that you can have it for them. Next, they're going to want to know your past medical history. So anything that, you've experienced, that you've been diagnosed with. For me, it's, high blood pressure, severe headaches, persistent snoring. Sorry, Stephen. Back pain, kidney stones. Those are all things that I have or had. They're also going to want to know, prior surgeries, procedures, or cardiac procedures, and pregnancies. I have not had pregnancies, thank God. Even though I feel like I kind of am pregnant. Anyway, moving on here. A big one, they're going to want to know allergies. This plays a role in the type of medication they can give you for surgery and afterwards. They're going to want to also know all your prescribed medications and OTC medication or over-the-counter medication, any vitamins or minerals you might be taking. So you're going to put all that stuff in there. They're going to want to know your tobacco use. Are you a smoker? How often you smoke, and for how long have you smoked? Same thing with alcohol. How much you drink, how long you've had it, is it a problem? Have you been treated before? And also about illicit drugs. So they want to know all about that. And then I thought this was kind of neat. I'm not sure if every place does this, but they're asking social history. So they're listing, like family members' names, where they live, and their relationship to me. And then how many of those people will be there to support me. So I said everybody. I'm lucky in that sense, I guess. But so yeah, they're asking for my entire, family member, immediate family information. How many of them will be there to support me? How many friends will be able to support me? Then they ask about, if I get upset when I talk about weight, things like that. And do I think that any of them will undermine my weight loss? Excuse me, my leg is falling asleep. There we go. All right. Then they ask if I have any issues with depression or anxiety. How motivated am I on a scale of 1 to 10 to lose weight this time? And they also ask a couple different questions about weight loss and what I've done in the past. Then they get into family medical history, starting with your mother and your father, and then your siblings and what their medical issues are, and then your family weight history. I've seen a lot of videos online where family weight history does play a role in how much weight you lose after you're sleeved. So I'm assuming that's why they asked this here. And then, of course, they ask your current weight, your lowest weight, your highest weight. Then they asked how much I weighed when I was 18. I have no idea. Not even going to lie. And then they ask about your weight loss history. So what programs did you use to help you lose weight? And then what were the outcomes of those? And then how long ago did you do those programs? Let's see here. And they ask about your food intake. So, what are you eating for breakfast, lunch, dinner? How much fluid are you taking in a day? Things like that. Then they ask about your eating habits, about, do you watch TV when you eat? Do you snack while you're on the computer? Things like that. And then they ask about your physical activity, which mine is very lacking. So they ask, what you do for physical activity, and then what hurts during your physical activity, which I thought was interesting. And then here they have, they review symptoms. So cardiovascular disease, heart failure, chest pain, all different types of diseases or symptoms or things like that you might have that could play in and have some sort of adverse effect on the procedure. Then they ask about your it's an Epworth sleepiness scale. So indicate the likelihood that you would fall asleep in the following situations. And they give you a bunch of different things, like sitting and reading, watching TV, watching this YouTube video. Just kidding. In a car, things like that. Hopefully you're not falling asleep in a car. Then they ask you to rate your quality of life. on a scale of 1 to 7. So, they give you a few sentences, and then you have to rate them 1 to 7. And then, what else? Then they have a SF-12 patient questionnaire, and that's to keep track of how I feel and how well I'm able to do in my usual activities. So they ask questions like, during the past 4 weeks, have you had any of the following problems with your work or other regular activities as a result of your physical health? So basically they want to know, if is you being fat causing you to have any problems throughout your daily life? Things like that. And that's pretty much it for this packet. I'm sure once I go to my consultation, there's going to be a lot more questions, and I'm sure I'm going to have a lot to ask them. So I hope this was in some way helpful to somebody out there, just so that they know what to expect as far as a questionnaire might go. And yeah, so that's it. I will keep everybody updated with how my consultation goes, which is on the 8th, and that is 2 days from now. So, other than that, I hope everyone has a great night, and I'll talk to you later. Bye.